Hi, I'm Christine Crowell here, and in 2008 I lost my care business. I didn't see the dangers that were coming before me, even though the signs were really there, but I didn't notice them. My rates were cut, costs went up, there was a recession, and I had a full team of office staff, as well as the carers and nurses in the field, which is absolutely wonderful. You know, they are there to serve. They were frontline staff. And the systems, they couldn't keep up. It cost me a lot. And I promised myself I would never let this happen again. And I wouldn't let it happen knowing what I know now. So if you are in the USA, healthcare provider, now in the United States, there's the new big beautiful bill. Some call it the big ugly bill. It's doing exactly what happened to me in 2008. Again. But for you it's Medicaid and Medicare. It's being cut. Rates are being reduced. Thousands of providers will lose clients or be paid less, like how I was, for doing more. You're having to double and treble the work and still receive the same. And if you are a care business, it's heavily reliant on these payments. I don't need to tell you this. This is your warning sign. The providers who don't adapt will be the ones closing their doors. Now, think about this. If you are a UK provider, a healthcare provider, in the UK, you won't be left far behind. Local councils are under pressure. They're freezing contracts. They're underpaying providers and ignoring inflation. So their rates, I've noticed, have reduced again, like how it did for me in 2008. So you might be earning 16 to 19, 23 pounds per hour, but the fuel, the wages, your compliance cost, and the team that you have in the office are rising. They're not getting a pay decrease. They expect a pay increase whilst you're being paid less. And when that next funding cut happens, where they cut your rates, or the recession hits, which I feel the recession is here, even though we haven't been told officially, but it smells, walks and talks like what I've seen before. It's going to hit hard if you don't act now, just like it did for me. So let's look at this. If I'd known what I know now, I would have been lean, automated business using AI agents. And this is why I've created this AI agents. I've been building this for over a year now, because I could see that this is coming, because the signs were there, because I've experienced it and I've seen how it repeats itself. Now, I would have cut my admin team cost by half immediately. And I don't mean this in a horrible way, but there's no point in the whole ship sinking If you can save your business and some of the team members in your business, like your frontline staff, like those that are hard to replace in your office, like I said, I would have cut my admin costs by half. I would have saved 2.5 million minimum. I would have created private paid packages to escape the council, and as well as the government contracts, for example, because I was so reliant on that. That was 99% of my business was government contracts. I was getting private clients coming in, but I was turning them away because I had government contracts that I was focused on, because they were coming in, and I had to deliver the service at high standards, so my capacity could only reach so much. And I wouldn't have taken on so much of the government contracts. They would have been the 5%. So I didn't have systems back then, but you have got that chance to have this now. Even with what is happening today, by using AI agents, by using that solution, it will still create a viable business for you. So that's why I've created my own AI agents for you, the care provider, to be able to survive in these difficult times. You would have looked at my videos previously, even from last year, where I started talking about building systems, creating lean automations, as well as AI tools, as well as business recovery skills. So whether you're in the UK or the USA, it really is time to run your healthcare business, whether it's home care, supported living, nursing agency, residential care home, for example, sheltered housing, assisted living facility. This is the time to act. We have a AI bootcamp, which is a 4-day bootcamp, and I'll walk you through step by step through setting up your own back office AI agents, automating admin, rotas, compliance, recruitment, and marketing through AI agents, replacing, even searching for contracts, replacing your bloated systems with lean, smart, and creative workflows. Creating a private paid package to stabilize your income, which will future-proof your business before the next big cut. And yes, you'll leave with your own AI agent ready to go. But if you don't have time to do that, we can help create those AI systems and implement them into your business so that you can just do the things that you are good at and focus on that. We will even train your team with the AI which we implement. So if you don't have time to attend our AI bootcamp, then maybe one of your staff members may be able to, or we will train your own team for your own AI agents for your business. I'm not just an AI agency. I'm an AI architect who has 35 years experience in healthcare industry, UK and the US. So don't wait until it's too late. Don't stick your head in the sand. I've been where you are right now, and I don't want you to lose what you've built. The blood, sweat and days, the long days, the weekends, evenings. Click the link below and join our bootcamp, or if you want a free 15-minute AI makeover, then let's do this. Let's help recession-proof your business using AI. You'll gain back your time, your freedom, you'll protect your income, and finally, you'll get a system that will work for you. This is the moment to lead a new way. I'll see you on the inside. Just click the link in the description, and I look forward to speaking to you very, very soon. Thank you. Take care. Bye.